I want to kind of tie all this together, what I was talking about, with the chronic inflammation from mitochondrial dysfunction and from the alteration of the gut bacteria by showing you a case study. As I go through this case study, I want you to think what systems are involved with this individual to bring everything together. And it's going to show us why this individual was experiencing all of these different things. So we got a 20-year-old male, had right SI pain, got to the point to where he could barely walk. It was a sharp pain. That was where it radiated from the low back down to like the right gluteal muscle. There was also a dull chronic achy pain that was constant. This pain was about a 10 out of 10 to the point where this individual, like I said, could barely walk. Excedrin brought it down to about a 9 out of 10. So this individual eventually, after a certain period of time, went and saw a sports medicine specialist. They took an x-ray. It showed degenerative changes on the right SI joint, sent this individual to a rheumatologist. So the rheumatologist diagnosed this individual with sacroiliitis, that's just inflammation of the sacroiliac joint. Put him immediately on 3 non-steroidal anti-inflammatory drugs. When the effect of those wore off, eventually this individual was put on 4 Vicodin a day. That was in addition to the 3 non-steroidal anti-inflammatory drugs. Hopefully you're already thinking the side effects this would be causing, especially to the GI tract. Remember, we talked about the problem with the GI tract is where the chronic inflammation began. Periodically, oral high-dose steroids were given about 4 to 5 times a year. We know some of the side effects of corticosteroids, which can be osteoporosis, can lead to fractures. Of course, increased risk of infections because we're depressing the immune system. This was over a course of 7 years from the age 20 to 27. So you can imagine the effect not only in the GI tract, but the liver, again, the skeletal system. NSAIDs. What's the problem with NSAIDs? We know that they inhibit the COX-1 and COX-2 enzymes. That's because these enzymes create prostaglandins. That's our inflammatory mediators. This is what leads to pain. So why not just use them? Well, the problem is we need these prostaglandins because they produce mucus that coats our stomach and it coats our small intestine. This helps us from getting ulcers and it protects that GI lining. That's why when somebody can be on NSAID for a certain period of time, they will get that GI bleeding. So why don't we just inhibit COX-2 and leave the prostaglandins alone that are created by the COX-1? And that's exactly what they did with the COX-2 inhibitors, like Celebrex. The problem with that is or Vioxx also. You might have heard of Vioxx. That was pulled off the market, thank goodness, because what happened is when they inhibited COX-2, everything was pushed to the other side. Well, not only does COX-1 produce prostaglandins that coat the GI mucosa, you can see there, it also leads to the formation of platelets that leads to blood clotting and vasoconstriction. So when everything was pushed down that pathway of COX-1, it started leading to heart attacks. Okay, people were out of pain, their arthritis got better, but they were dropping dead. Well, you don't feel much pain when you're dead. So that didn't do much good. So they took Vioxx off the market, thank goodness. Here we have NSAIDs in cardiovascular disease. That's what they're starting to find out now. A lot of this newest research, you can see that's from 2015. Well, not only are NSAIDs starting to cause cardiovascular problems, you can see part of the reason it talks about there is the role in reactive oxygen species. And we talked about that. So why don't we just use something like Vicodin or painkillers? They're very effective because at the level of the spinal cord, you can see there at the dorsal horn, and even at the level of the brainstem itself, where we have nerve transmission, these painkillers, they stop us from feeling that sensation of pain. Like I said, at the level of spinal cord and the level of the brainstem. That's great, right? Well, they have their problems too. With our opioids, we see a lot of things. Dizziness, even hyperalgesia. I came across a researcher who talked about opioids eventually with their chronic use can lead to hyperalgesia. And hyperalgesia is an increased sensitivity to pain. Well, they're trying to block pain. The last thing we want is an increased sensitivity to pain. And then the worst, addiction. We see a lot of addiction with our opioid painkillers.